Welcome back to UltraLife Today, and what I have to say has been one of my favorite conversations in my entire life of loving supplementation and wanting to understand it and how it can profoundly change the trajectory of your health from being a baby in your mother's womb. You've learned in this interview with Dr. Michael Holick all the way through into old age. We'll cover a little bit of that in this segment. That's going to be some really interesting things related to vitamin D and cognition, things you may not have thought had a very strong relationship together. It's my pleasure once again to bring Dr. Michael Holick, professor of medicine at BU Medical Center. Look up this gentleman's CV sometime, and then I dare you to try to see if you can count the number of studies that he has authored or co-authored on PubMed. It is quite impressive, and he is as passionate today, or maybe more so, about studying vitamin D than he was those years ago when he did a phytoplankton experiment with his roommate in college that was quite interesting. So welcome back again, Dr. Michael Holick. We so appreciate the time today, and we're going to run down some quick trails here and answer some of my questions. But, I'd like to come right out of the gate because cognitive health, as you know, like everything else, massive decline. People don't understand it. There's been many drugs that they have introduced to try to help with Alzheimer's, to help with this cognitive decline that we're seeing all around us, people talking brain fog, especially since COVID. I was keying in on one of your lectures, and you blew my mind with some things related to vitamin D, cognition, Alzheimer's, aging, the aging of the brain. Please unwrap some of that for us because it was very interesting to me. And I bet you've got your hands in some further exploration and research there. It was amazing.
So what we know is that your brain cells have a vitamin D receptor. And so you always have to ask the question, Mother Nature doesn't waste effort in making things unless they're going to be used. And if you have a vitamin D receptor, that means that it wants to interact with the active form of vitamin D and to unlock genetic information. And there's a lot of information to suggest that vitamin D deficiency, especially severe vitamin D deficiency, markedly increases risk for neurocognitive dysfunction and Alzheimer's disease. There's some evidence to suggest that active vitamin D helps cells to remove some of those protein fibrils that are associated with Alzheimer's disease. And so not a lot of research has been done to understand what the mechanisms are, other than it appears that it plays a fundamental role in controlling nerve function through calcium metabolism. And like I said, I think that it improves brain cell health.
Now, do I recall you talking about some case studies as it related to elderly patient populations and what could take place with proper vitamin D sufficiency there?
So one of the issues has been for elders and another myth that I'm happy to bust for you, which is that aging decreases your ability to absorb vitamin D. Okay. It does not.
Oh, nice to know. Nice to know.
Right. But what we also showed is, and not unexpected, is we know that our skin begins to get thinner with aging. And sure enough, we showed that if you compare a 20-year-old to a 70 or 80-year-old and expose to the same amount of sunlight, the 80-year-old will only make about maybe 25% the amount of vitamin D that a young person would make.
Which means
Does that mean
which means the issue of supplementation is critical in the elderly. And as we know also, many of them are probably spending less time outdoors, especially if they're in a shut-in situation or something like that. Okay, less active.
Right. And so we then did a study, and there was another study done in Australia where they took elders and put them outside in the sun. And even though the skin has less of a capacity, your skin in general has such a huge capacity to make vitamin D that those elders wheeled out on a veranda, exposing their legs and their arms to sunlight, could raise their blood levels very nicely for
Interesting.
vitamin D, of 25-hydroxy vitamin D. So even though aging decreases the ability to make vitamin D in your skin, the efficiency, there's no reason for elders not to go outside. Also, like I said, you make beta endorphin and you
Here we
make
go.
nitric oxide, all of which are really important for all of us, including elders.
It, it,
And so I urge elders to get some sensible sun exposure.
is there an indication for you? Have you seen a correlation between individuals suffering from depression? I know there's this seasonal affectational disorder that they've talked about, and they map it across the states, probably much like your mobile app, that literally shows in these pockets of where people have months of no sunlight, they're experiencing seasonal depression. But have you seen a correlation between vitamin D deficiency and its effect on individuals either with a history of depression or in depression and being able to somehow take the edge off that depression?
So seasonal affective disorder is due to the decrease in the intensity and duration of sunlight. And that will happen in about 40 to 50% of the population, believe it or not. And so bright light therapy works quite well. There was a study, however, done at NIH where they gave seasonal affective disorder subjects vitamin D versus bright light, and they showed that the vitamin D helped improve mood.
Wow.
There is evidence in animal studies that if you're vitamin D deficient, that you have less serotonin in the brain, and giving them vitamin D improve their serotonin levels, right? Which is the way antidepressants work. So there is suggested evidence that improvement in vitamin D status makes you feel better. You have less aches and pains. You're more likely to be more mobile. And as a result, improves your mood. And so it helps depression as a result.
Yeah, what is not to like about that? I mean, all of us, I think, can just think of springtime coming into summer, wearing less clothes and getting outside, and all of a sudden, and when I heard that in one of your lectures, I was like, that makes so much sense that serotonin has a direct relationship with vitamin D deficiency or sufficiency and the production thereof. So that was super exciting. Now, I want to get into something quickly because it's kind of been a worldwide phenomenon in terms of the amount of scientific literature out there. Strangely enough, we don't hear about it on the news in the United States, and we don't hear about it on the news in the UK. But there are doctors that have begged, pleaded, demanded, signed petitions related to vitamin D and this thing we call SARS-CoV-2. I would love to know what you know about vitamin D and SARS-CoV-2, some of the studies you've looked at, and then I'd like to frame that up and talk about another form of vitamin D called calcifediol and talk for a moment about that as well with you. I'm interested to learn what you know about that and how that could potentially be a therapeutic intervention during these crazy times with the SARS-CoV-2.
So once COVID hit, I immediately contacted my colleagues at Quest Diagnostics because I had helped them set up the vitamin D assays decades ago. And we collected 191,000 samples. And we
Unbelievable.
related COVID infection and showed a dramatic effect that if you had a blood level of at least 34 nanograms per ml, you had a 54% less likelihood of acquiring COVID. We then did a
Wow.
study in Iran where we asked a question where people were coming in with COVID infection. Their blood level of vitamin D, of 25-hydroxy-D, was measured, and then asked the question, if they came in vitamin D sufficient, were they more likely to leave the hospital? And the answer is yes, that if you had a 25-hydroxy vitamin D level of at least 40 nanograms per ml when you entered that hospital, you had a more than 40% chance of surviving compared to those that were vitamin D
That's
deficient.
brilliant. That is brilliant. And what about mortality?
Yeah, and that was not only, well, that is mortality, right?
Yes.
Is that 40% higher likelihood of leaving that hospital. So you had a 40-50% higher mortality if you were vitamin D deficient. And we also did a study at our own hospital at Boston Medical Center and showed exactly the same. And what was also interesting in our study is that obese people did not benefit as much.
So it sounds as if and that's what I've loved about what we've learned from around the world during COVID, with vitamin D research coming from Spain, coming from so many different countries, large studies over periods of like a year and a half or so. Has it surprised you that there hasn't been some type of recommendation for something as simple as vitamin D during this crisis?
It's a very big surprise.
Shocking,
and what was shocking for me is that we had the information at our hospital that if they were vitamin D sufficient when they came in, that they had improved outcomes. I tried to convince my hospital to be giving all patients as they're coming in vitamin D, and they did not want to hear about it.
Well, so this is
too simplistic. It's a vitamin.
So this is a beautiful segue into my next segment. So there's some people that became internet phenomenons over the COVID crisis. One is a gentleman I've really hold dear to my heart. His name is Dr. John Campbell. He's a teaching nurse in the UK, and he's brought a lot of his different friends on. And he did an interview with a Dr. David Grimes on vitamin D, who doesn't pretend to be in the rarefied air that you're in at all. But it was a fascinating discussion between two guys in their 80s looking at vitamin D, and Dr. Grimes mentioned a scenario that introduced me to calcifediol, and that's why I want to go there with you next. And this was the scenario. He was very close friends with a group of Asian frontline doctors. They were part of an organization over there. COVID hits, and like 3 of them, basically, if I remember the story correctly, 2 or 3 of them literally succumbed to COVID and died almost immediately. David Grimes, knowing what he knew about vitamin D and knowing that there's this form of vitamin D called calcifediol that can rapidly raise an individual's vitamin D levels into sufficiency, he sent an email to his friend that was the head of that board, and he said, you and your colleagues immediately have to get on calcifediol. You've got to get your vitamin D levels up. They did, and this was a very large group of physicians that were frontline doctors in many different places across the UK. They only had one more person die after that, and after that period of time, nobody was getting COVID. Nobody was getting reinfected. It was, I know this is anecdotal, but I have to ask you the same question because Dr. David Grimes and Dr. John Campbell basically ended this interview with Dr. Campbell saying, Dr. Grimes, if an individual got their levels up to 40, on their vitamin D test, what do you think their chances are of even contracting COVID? And Dr. Grimes didn't blink an eye and said, we've seen people basically get their levels up to 40 and never have COVID again. So I'm curious what your thoughts are there, because that information blew me away. But tell us too, because I know calcifediol's not available around the world everywhere, but to me, in the crisis we've got with so many people already being vitamin D deficient, taking 2 months to get there, that could be a struggle, and it could be a problem, especially for people with comorbidities. Tell us about calcifediol, and is it a good therapeutic intervention, or is it even something that one could use to have easy compliance by only taking it maybe once every couple of weeks? I know you have a philosophy about how you recommend people taking vitamin D as well. I've heard you talk about the 50,000 units at this interval and that interval and that interval. So I covered a lot of ground, but I know you can hit me back with all the answers I'm looking for.
So it turns out that calcifediol is 25-hydroxy vitamin D3. So your vitamin D3 goes to your liver and is converted to 25-hydroxy vitamin D3. When this was discovered back in the 1970s, it was obvious. Why not make calcifediol, 25-hydroxy vitamin D3, and give it to patients? And it was available, believe it or not, in the United States.
Wow.
But it never took off. It's now available as a supplement in Australia. It's available as a pharmaceutical in Spain and in many other countries. And so you would expect that if calcifediol is 25-hydroxy vitamin D3, if you're taking it, you would raise your blood levels that much more quickly than it would be taking vitamin D, which takes some time to go to your liver to get converted to 25-hydroxy vitamin D. But we also have done other studies with calcifediol, which we found to be very helpful. And that is, we know that if you're obese, right, you can't always figure out how much vitamin D to take, right? But we did a study in obese and non-obese and showed that the blood levels of 25-hydroxy D are identical for the same dose of calcifediol.
So that issue of having all the adipose tissue doesn't apply in raising the levels of vitamin D for those using calcifediol to do it.
We're raising 25-hydroxy vitamin D. That's
impressive.
Correct.
Impressive.
The other is that when you understand how vitamin D is absorbed, which is it goes through your what are called micelles, and then it has to go through your lymphatic system and up into your superior vena cava, 25-hydroxy D is more water soluble. So it gets absorbed through the portal system. So we did another study and showed patients with fat malabsorption syndromes absorbed calcifediol equally as well as a healthy, normal person.
So that really could be could have been and still could be a beautiful therapeutic intervention for an individual that's obese, that probably has other comorbidities, and is probably scared that they're going to end up in an emergency room and on a ventilator. That could be a way to really help them bolster their immunity to SARS-CoV-2. That's incredible. It's incredible.
Yes.
I got on a website because my daughter's in Paris right now with my granddaughter. They're there for about 30 days. And it appeared to me that calcifediol could actually be purchased over the counter in Paris. So I was pleased to note that there seems to be a variety of places where in UK, sadly, it's only a prescription item. But in a lot of the other countries, it looks like you can get it over the counter now, which is neat.
Yeah, but you can't. In the United States, it's not available.
Right. So,
other than very high dose, slow release, and it's for kidney failure patients.
Okay, now for me, getting in the habit of taking something every day is the way I'm going to be consistent, no different than working out, walking, eating the right foods. But I've heard you say in a couple of your lectures that there is a way for individuals that may not want to take capsules every day of utilizing this kind of high dose way to get your vitamin D levels up. Would you explain that?
Sure. So in the United States, we have what's called a 50,000 unit dose of vitamin D. It happens to be vitamin D2 because it predates the FDA. So it's the only pharmaceutical form, believe it or not.
Okay, so it is prescription only.
Only.
Okay.
Well,
okay.
no. I mean, you could get vitamin D2 as a supplement, but
right.
50,000 units.
Gotcha.
But also you can get a 50,000 unit D3 as a supplement as a prescription.
Perfect. Okay.
And so my thinking was when you're vitamin D deficient, you want to fill your tank, right? Tank's on empty. So I gave 50,000 units once a week for 8 weeks. It's equivalent to 6,600 units a day to raise the blood level. And then the doctors didn't know what to do after 2 months. So I said, now you put them on every other week forever. So now they're on 3,300 equivalent units forever. And like I said, we did that 6-year study and showed that their blood levels are perfectly normal between 40 and 60 nanograms per ml.
Yeah, because I think it's so important, because one of the biggest problems I find among supplement users or even individuals that have prescription medications, compliance is so very difficult at times, and many people over a certain age just don't want to keep swallowing more pills. So I think that's a beautiful way to help an individual get their vitamin D levels up. Okay, this is a pet question that I and one of my close friends are going to ask. Is there anything we found out about sports performance and vitamin D levels? Has anybody plumbed anything in that arena? Because I kind of look at it, it's probably a sleeper out here that probably could help someone with sports performance, but it's probably never been studied.
No, it actually has been studied.
It has, okay.
Several times. Yeah, and the results are mixed. And part of the reason is it depends on the dose of vitamin D and whether that athlete was vitamin D deficient. And so, in my opinion, if you're vitamin D deficient, we did a study in a very rare case of severe vitamin D deficiency. His muscle strength was so poor, he could not get from a sitting to standing position.
Wow.
And only giving him vitamin D did it work. But if your vitamin D relatively sufficient, I think that it's hard to know whether taking additional vitamin D is going to have any additional benefit for sports performance.
So it's not going to be that magic edge that everybody's been searching for. Probably not.
Maybe yes, maybe no, because I'll tell you, the Blackhawks, which is a group in Chicago playing hockey.
Yep.
It's a hockey team.
Yep.
They gave them 5,000 units a day, and they won the Stanley Cup that year.
Ah.
So hard to know.
Interesting. Well, I'm going to start calling on professional sports teams and selling them my magic potion of vitamin D.
Well, I've been a consultant for several of the sports teams in Boston, making that recommendation.
Nice. Let's see if there's anything we want to round out our segment with here, because we've got a little bit left. Is there anything on your heart that you would like to talk about as it relates to moving forward in this world of vitamin D? And I know I did want to bring up one thing that's near and dear to my heart, but is there anything first that you would like to share with our audience?
Well, just that you had asked me, what am I doing now in the future?
Yeah.
And one of the totally unknown areas of vitamin D that we're now exploring is, how the heck does vitamin D get into your live fat cell?
Oh, wow.
How does it get incorporated into your lipid droplet? And how and what signal tells it to come out? So we've initiated studies looking at that right now.
Incredible. So I only discovered yesterday that you had for quite some time been studying a disease called Ehlers-Danlos syndrome, EDS for short. Takes on a variety of faces, hypermobility disorder and other things. I've learned about it because a very near and dear to me relative got a diagnosis of that. I'm finding now that I'm hearing about this from integrative and functional medical doctors all around the world. Many are scratching their heads. Many are saying, are there seminars? And there are some. And mast cell activation syndrome, a whole host of things. They're trying to study around that to try to figure it out. But with what I learned about where you have sat in regard to that out there at Boston, we would love to bring you back at some point in time to talk about that, because I think many of our practitioners will probably consider your perspective on that a masterclass. Can you just give briefly a little description of Ehlers-Danlos, and then what role you have played in kind of developing understanding about that disease?
So I've been seeing Ehlers-Danlos patients and writing about Ehlers-Danlos and metabolic bone disease since 1980.
Unbelievable.
I've seen well over, probably now close to almost 5,000 Ehlers-Danlos patients, both infants, children, and adults. And you're right. What's amazing about this genetic disorder is totally unappreciated. in the medical community, because these patients, they come to their doctor and they say, "Doctor, I get up quickly and I feel lightheaded and my heart beats faster than my chest." And the doctor said, "Well, you're probably dehydrated. Drink more water. It doesn't do any good."
Yep.
Because they have orthostatic postural orthostatic
Right.
tachycardia syndrome.
Yep.
They
POTS.
go to the doctor and they say, "Doctor, I flush easily. I'm sweating profusely. What do you mean?" So, and the doctor said, "Well, that's just normal. Or you have allergies." No. As you said, mast cell hypersensitivity, right? Patients complain, "Doctor, I really feel uncomfortable when I'm eating a normal size or large meal." And the doctor said, "Well, so be it," right? No. That's called gastroparesis. Can be associated with diarrhea, can be associated with constipation, a whole host of other issues. They have poor wound healing. They have hypermobility of their joints that can cause some dislocation, early onset osteoarthritis. They have high dental palate. They have crowded teeth. They can have what's called morphinoid features. They can have pisogenic papules on their feet. And that's just the beginning of what this
Wow.
genetic disorder
It's so
does for these
complex.
poor people.
Yeah, it's so complex. Well, thank you for saying that, because I do hope that's a setup for a lengthy conversation about that, because I think your knowledge is going to set a lot of people free. And there's so much confusion about even finding a doctor that can treat that. And so we'll get into that off camera, but also on our next segment with you. I want people to know how they can reach Dr. Holick. I think this guy's going to become one of your best friends as it relates to resources for vitamin D and everything it can do for your health to promote longevity, to help you avoid the nightmare of some of the worst types of diseases out there. And it's inexpensive, it's available, and the gentleman who is the world authority is telling you really simple, practical steps about what you can do to integrate it in your life and become vitamin D sufficient. The way you want to get a hold of him, please go buy the book, The Vitamin D Solution by Dr. Michael Holick. The Vitamin D Solution, Dr. Michael Holick. Facebook, you can reach out to Dr. Michael Holick, Dr. Michael Holick. And then his website, which has a plethora of information for you, drmichaelholick.org. And we'll be putting those things up on the screen as well so that you can reach out to him. The gift of your time has been astonishing today. Thank you for tirelessly doing what you're doing. I promise you, you've probably made an impact around the world as it relates to this ripple effect of you continuing to get out there and speak to health professionals about vitamin D. Can we get you back and keep building the relationship, Dr. Holick?
It would be wonderful. Happy to do it.
We would love it, and we'd certainly like to also, as we build relationship, help point people to some of the things you are doing to raise money for incredible causes that you've been involved in that could change the health of hundreds, if not millions of people. Thanks again for the time.
My pleasure. Thank you.
Okay, UltraLife Today.